with Doctor Frempomaa. I've been talking about cervical cancer, some say cervical cancer, and it's of particular interest and importance because it's the second most highest cause of death in women. We hear a lot about breast cancer, and it makes sense because it really is a terrible disease. This is October, and October is usually dedicated to breast cancer, but I wanted to take the opportunity to talk about cervical cancer as well. And the reason why is because cervical cancer tends to have a better outcome when you catch it and you manage it. It is also preventable. So it's preventable by vaccinating against the number one cause of cervical cancer, which is the human papilloma virus. It is easily treatable when found very early on in stage. And so cervical cancer is quite important. I remember when I was in the university, that is when in the US, they were screening all the young women and asking all of them to vaccinate. And so Ghana is way behind when it comes to cervical cancer screening and just basically not being overcome by the burden of cervical cancer. It should not be an issue because it's easy to diagnose, and it's also relatively easier to manage. So cervical cancer, if you're asking yourself how long it takes for a person to develop it, know that it begins to develop when normal cells in the lower portion of your uterus change or mutate. They first become precancerous, and then they grow out of control, and they may spread to nearby tissue as well as other parts of the body. If left untreated, they may grow into a mass or a tumor. The process of precancerous cells developing into cancer often takes years. Cervical cancer is most frequently diagnosed in women between the ages of 35 and 55. It's uncommon for cervical cancer to be diagnosed in women under the age of 20, while about 20% of cases are diagnosed in women older than 65. This month at Arama Medical, we're having free breast screenings for breast cancer, and we're having cervical cancer screening as well at different levels, basically to try and fit your pocket size. So there's a very basic one that can be done called a VIA. You can also have your PAP done as well as a PCR. So we're really going all out this month for cervical cancer screening as well as breast cancer screening, and we ask that you come through and take this responsibility and get it detected early. You can call us at 02000 20706 or WhatsApp 0540 315 915.